Picture this. You're sitting in your doctor's office, and the nurse reads your blood pressure out loud, 142 over 88. She frowns slightly, writes it down, and before you know it, your doctor is talking about adding another medication to your already full pill organizer. But here's what nobody tells you. That perfect blood pressure number you've been chasing your whole life? It might actually be wrong for you now that you're over 60. What if I told you that the blood pressure guidelines that work for a 40-year-old could actually be dangerous for someone in their 70s or 80s? Stay with me, because what you're about to learn could change everything you think you know about blood pressure, and it might just save your life. Hello, my friend, and welcome back to the channel. If you're new here, we focus on bringing you the most important health information specifically for adults over 60 because your health needs are different, and you deserve advice that actually applies to you. Today, we're tackling one of the most confusing and misunderstood health topics for seniors, blood pressure. And I'm not just going to give you a simple number and send you on your way. No, we're going to dig into the real truth, the information that many doctors simply don't have time to explain during those rushed 15-minute appointments. Here's why this matters so much. High blood pressure, also called hypertension, affects nearly 2 out of every 3 adults over the age of 60. That's millions of people walking around right now with blood pressure that's either too high, putting them at risk for heart attack and stroke, or being treated too aggressively, which comes with its own serious dangers. And here's the thing that surprises most people. As we age, our blood pressure naturally changes. Our arteries stiffen a bit. Our hearts work a little differently. And what was considered dangerous at 40 might actually be perfectly normal, even protective, at 75. So let's cut through all the confusion together. By the end of this video, you'll understand exactly what blood pressure numbers mean for your age group, when to be concerned, and most importantly, how to work with your doctor to find your perfect blood pressure target. Are you ready? Let's dive in. Before we talk about the best blood pressure for older adults, let's make sure we're all on the same page about what blood pressure actually is. Don't worry, I'm going to keep this simple and easy to understand. When we measure blood pressure, we get 2 numbers. You've probably heard them called out at the doctor's office. 120 over 80 or 135 over 90. The top number is called your systolic pressure. Think of this as the pressure in your blood vessels when your heart beats, when it squeezes to push blood out. This is the stronger push. The bottom number is called your diastolic pressure. This is the pressure between heartbeats when your heart is relaxing and filling back up with blood. Now, here's something many seniors don't realize. As we get older, that top number, the systolic pressure, tends to rise. Meanwhile, the bottom number often stays the same or even drops a little. This is completely normal and happens because our arteries naturally become slightly stiffer over time. So when your doctor talks about high blood pressure in older adults, they're usually most concerned about that top number. For decades, we were all told that normal blood pressure was 120 over 80. That was supposed to be the golden standard for everyone, young, old, and everyone in between. But here's where things get interesting. Medical research over the past 10 to 15 years has completely changed how we think about blood pressure in seniors. We now know that what's ideal for a 35-year-old is not the same as what's ideal for a 75-year-old. Let me give you a quick example. Imagine 2 people with blood pressure of 150 over 90. Person A is 42 years old, runs marathons, and has no other health problems. For this person, 150 over 90 is definitely too high and needs immediate attention. Person B is 81 years old, lives independently, takes a few medications, and has been healthy their whole life. For this person, 150 over 90 might be perfectly acceptable, and trying to push it down to 120 could actually cause problems. Are you starting to see why this isn't as simple as hitting one magic number? Now let's talk about the official guidelines and why they've been so confusing over the years. If you've been paying attention to blood pressure recommendations, you might have noticed they seem to change every few years, and I understand how frustrating that can be. One year they say one thing, the next year something different. It's enough to make anyone throw their hands up and say, "Just tell me what to do." Let me walk you through what's happened and where we are now. For many years, the general guideline was that blood pressure under 140 over 90 was acceptable for most adults, including seniors. Then, in 2017, major health organizations changed the definition of high blood pressure. Suddenly, anything over 130 over 80 was considered elevated or high. This single change meant that literally millions of Americans woke up one morning with high blood pressure who didn't have it the day before, without their actual blood pressure changing at all. Now, for younger adults, this stricter guideline makes sense. Research shows that keeping blood pressure closer to 120 over 80 in middle-aged adults can significantly reduce the risk of heart disease and stroke over time. But here's where it gets complicated for those of us over 60. A major study called SPRINT, which stands for Systolic Blood Pressure Intervention Trial, looked at whether aggressive blood pressure treatment helped older adults. The study found that pushing systolic blood pressure below 120 DID reduced heart attacks and strokes in some seniors. But, and this is a big but, it also found that aggressive treatment came with serious side effects: more falls, more fainting episodes, more kidney problems, more confusion and dizziness. So what does this mean for you? The current thinking among geriatric specialists, doctors who specifically focus on older adults, is that blood pressure targets should be individualized based on your overall health, your other medical conditions, and your quality of life. Let me break this down into more practical terms. For healthy older adults aged 60 to 75, a target of around 130 over 80 is generally reasonable. This balances protection against stroke and heart attack while minimizing side effects from overtreatment. For adults aged 75 to 85 who are in good health, a slightly higher target of 130 to 140 over 80 to 90 might be more appropriate. The goal is to prevent stroke without causing dangerous drops in blood pressure that could lead to falls. For adults over 85 or those with multiple health conditions, the target often needs to be even more relaxed, sometimes up to 150 over 90, because the risks of aggressive treatment often outweigh the benefits. For frail seniors or those with limited life expectancy, comfort and quality of life become the priority. Sometimes blood pressure medications are actually reduced or stopped entirely because they're doing more harm than good. Now, I want to be very clear about something. These are general guidelines, not personal medical advice. Your ideal blood pressure target depends on your specific situation, but this gives you a framework for having an informed conversation with your doctor. Now we need to talk about something that doesn't get enough attention: the very real dangers of treating blood pressure too aggressively in older adults. Many seniors I speak with believe that when it comes to blood pressure, lower is always better. But that's simply not true once you reach a certain age. Here's what can happen when blood pressure is pushed too low in seniors: dangerous falls. This is probably the biggest concern. When blood pressure drops too low, especially when you stand up from sitting or lying down, you can become dizzy or lightheaded. For a younger person, this might just mean grabbing onto something for a moment. But for an older adult, it can mean a fall. And falls are serious. Very serious. A hip fracture in someone over 75 can be life-threatening. The recovery is difficult, and many people never regain their full independence after a major fall. If you've ever stood up and felt that wobbly, dizzy sensation, please mention this to your doctor. It could be a sign that your blood pressure is dropping too low. Kidney problems. Your kidneys need adequate blood pressure to function properly. When blood pressure is pushed too low, the kidneys don't get enough blood flow, and over time, this can actually cause kidney damage. Ironically, high blood pressure can also damage kidneys, so finding that middle ground is crucial. Cognitive issues. Your brain also needs consistent blood flow to work its best. Some research suggests that very low blood pressure in older adults can contribute to confusion, memory problems, and reduced mental sharpness. If you've noticed you're not thinking as clearly since starting or increasing blood pressure medication, this is worth discussing with your doctor. Fatigue and weakness. Many seniors on blood pressure medications complain of feeling tired, weak, or just not like themselves. Sometimes this is simply the medication working too well and dropping blood pressure lower than it needs to be. Now, I want to pause here for a moment. If you're over 60, or if you're caring for an elderly parent or loved one, this information could genuinely be life-saving. Blood pressure management in seniors is not one size fits all, and too many people are either undertreated or overtreated. If anything I've said so far has resonated with you, if you've experienced dizziness, falls, or fatigue on blood pressure medication, please don't ignore those signs. And if you're finding this video helpful, would you do me a favor? Hit that subscribe button and tap the bell so you don't miss our future videos on senior health. We're building a community here of people who want to take control of their health as they age, and I'd love for you to be part of it. All right, let's continue. One of the most powerful things you can do for your health is to monitor your blood pressure at home. And I mean that sincerely. Home monitoring can give you and your doctor information that's actually more accurate than what's measured in the office. Why? Two words: white coat syndrome. Many people, especially older adults, get nervous at the doctor's office. Maybe it's the clinical environment, or maybe it's worry about what the doctor might find. Whatever the cause, this anxiety can temporarily raise blood pressure, sometimes significantly. Studies suggest that up to 30% of people diagnosed with high blood pressure actually have white coat hypertension, meaning their blood pressure is only elevated at the doctor's office, but is perfectly normal at home. If you're being treated for high blood pressure, you might actually be taking medication you don't need. Home monitoring can help identify this. On the flip side, some people have what's called masked hypertension. Their blood pressure is normal at the doctor's office, but high at home. This is also important to catch. So how do you monitor at home correctly? First, invest in a good quality blood pressure monitor. Look for one that goes around your upper arm. These are more accurate than wrist monitors. You can find reliable ones for $40 to $60 at most pharmacies or online. Look for monitors that are validated by organizations like the American Heart Association. Second, follow proper technique. Sit quietly for 5 minutes before taking your reading. Don't smoke, exercise, or drink caffeine for 30 minutes before. Sit with your back supported and feet flat on the floor. Rest your arm on a table at heart level. Don't talk while the measurement is being taken. Third, take readings at consistent times, ideally morning and evening. Take 2 or 3 readings each time, waiting a minute between each one, and record all of them. Fourth, keep a log and bring it to your doctor appointments. This gives your doctor a much better picture of your true blood pressure than a single reading in the office. Now, here's something important. Don't panic if you see an occasional high reading. Blood pressure naturally fluctuates throughout the day based on activity, stress, meals, and even the weather. What matters is the overall pattern over days and weeks. All right, let's talk about what you can actually do to support healthy blood pressure as you age. The good news is that lifestyle changes can be incredibly powerful, sometimes powerful enough to reduce or even eliminate the need for medication. Strategy number 1. Mind your salt, but don't go crazy. You've probably heard that salt raises blood pressure, and for many people that's true. Reducing sodium intake can help lower blood pressure by several points. The general recommendation is to aim for less than 2,300 milligrams of sodium per day, about 1 teaspoon of salt. But here's the nuance. Not everyone is equally sensitive to salt. Some people see dramatic blood pressure drops when they reduce sodium, while others barely notice a change. Also, going extremely low on sodium isn't always wise for older adults, especially if you're taking certain medications or have other health conditions. Talk to your doctor about what sodium level makes sense for you. Practical tip. Most sodium in our diet comes from processed and restaurant foods, not from the salt shaker at home. Focus on eating more fresh, whole foods and cooking at home when possible. Strategy number 2. Embrace potassium-rich foods. While we talk a lot about reducing sodium, we don't talk enough about increasing potassium. Potassium helps balance out sodium's effects and can help lower blood pressure naturally. Foods high in potassium include bananas, oranges, potatoes, tomatoes, beans, and leafy greens. Try to include these in your daily diet. One caution: if you have kidney disease or take certain blood pressure medications called ACE inhibitors or potassium-sparing diuretics, talk to your doctor before significantly increasing potassium. Too much can be harmful in these situations. Strategy number 3, stay active, even gently. Regular physical activity is one of the most effective ways to manage blood pressure naturally. And the good news is, you don't need to run marathons or lift heavy weights. Walking is wonderful. Swimming is excellent because it's easy on the joints. Gentle yoga and Tai Chi are also beneficial. They've been shown to help lower blood pressure while improving balance and reducing stress. Aim for about 150 minutes of moderate activity per week. That's just over 20 minutes a day. But even if you can only manage 10-minute walks, that's valuable. Something is always better than nothing. Strategy number 4, maintain a healthy weight. Carrying extra weight makes your heart work harder and tends to raise blood pressure. If you're overweight, losing even 5 to 10 pounds can make a noticeable difference in your blood pressure readings. But I want to be realistic here. Dramatic weight loss isn't always possible or even advisable for older adults. Focus on gradual, sustainable changes rather than crash diets. And remember, being slightly overweight in your 70s and 80s is actually associated with better outcomes than being underweight. Strategy number 5, limit alcohol. Moderate alcohol consumption might be okay for blood pressure, but heavy drinking definitely raises it. If you drink, try to limit yourself to 1 drink per day for women and 2 for men. And remember, as we age, our bodies process alcohol differently, so what you could handle at 40 might hit you harder at 70. Strategy number 6, manage stress. Chronic stress keeps your blood pressure elevated through hormones like cortisol and adrenaline. Finding ways to relax and manage stress can have real effects on your numbers. This might mean spending time with loved ones, pursuing hobbies you enjoy, practicing deep breathing exercises, or simply taking time each day to do something that brings you peace. Many seniors find that limiting news consumption and social media also helps reduce stress levels. Strategy number 7, get quality sleep. Poor sleep is linked to higher blood pressure. If you're snoring heavily, waking up frequently, or still feeling tired after a full night's sleep, you might have sleep apnea, a condition that's very common in older adults and significantly affects blood pressure. Ask your doctor about a sleep study if you suspect this might be an issue. I want to empower you to have better conversations with your healthcare provider about blood pressure. Here are some questions I encourage you to ask. Question number 1. What is my target blood pressure given my age and health conditions? Don't assume your doctor is using age-appropriate targets. Politely ask what number they're aiming for and why. A good doctor will appreciate your engagement and explain their reasoning. Question number 2. Am I experiencing any side effects from my blood pressure medication? Describe any symptoms you've noticed. Dizziness, fatigue, confusion, frequent urination, anything. Your doctor may not know you're having problems unless you speak up. Question number 3. Could my blood pressure medication be causing my falls or dizziness? This is especially important if you've had falls or near falls. Sometimes simply adjusting the timing or dose of medication can make a big difference. Question number 4. Do I really need all of these blood pressure medications? As we age, the benefits of aggressive blood pressure treatment may decrease while the risks increase. It's completely reasonable to ask whether any of your medications could be reduced or eliminated. Question number 5. How often should I be checking my blood pressure at home? Your doctor can give you specific guidance on home monitoring based on your situation. Question number 6. What blood pressure reading should prompt me to call your office? Know when to seek help. Everyone should know their emergency number, the blood pressure reading that warrants immediate medical attention. Remember, you are your own best advocate. Don't be afraid to ask questions or seek a second opinion if something doesn't feel right. Before we wrap up, I need to share some warning signs that require immediate medical attention. Please don't ignore these. Signs of dangerously high blood pressure. Severe headache that feels different from normal headaches. Chest pain or tightness. Shortness of breath. Vision changes. Blurred vision or seeing spots. Difficulty speaking or sudden confusion. Severe anxiety or feeling of doom. Nosebleeds that won't stop. If you experience these symptoms and your blood pressure is over 180 systolic or 120 diastolic, call 911 or go to the emergency room immediately. This is called a hypertensive crisis and needs urgent treatment. Signs of dangerously low blood pressure: feeling faint or actually fainting, severe dizziness, especially when standing, confusion or inability to concentrate, blurred vision, nausea, cold, clammy, pale skin, rapid, shallow breathing. If you experience these symptoms, sit or lie down immediately to prevent falling, drink some water, and contact your doctor. You may need your medications adjusted. My friend, we've covered a lot of ground today, so let me summarize the key points. First, there is no single perfect blood pressure number for everyone over 60. Your ideal target depends on your age, your overall health, your other medical conditions, and your quality of life goals. Second, as we age, slightly higher blood pressure may be acceptable, and treating too aggressively can cause serious problems like falls, kidney damage, and cognitive issues. Third, home blood pressure monitoring is a powerful tool that gives you and your doctor better information than office readings alone. Fourth, lifestyle changes. Eating well, staying active, managing stress, sleeping well, and maintaining a healthy weight can significantly impact your blood pressure naturally. Fifth, you have the right to ask questions and be an active participant in your healthcare decisions. I want you to know something. Getting older doesn't mean accepting decline. It means understanding your body better and working with it, not against it. And when it comes to blood pressure, knowledge truly is power. You deserve a doctor who takes the time to explain things, who considers your individual situation, and who treats you as a whole person, not just a number on a chart. If this video has helped you understand blood pressure better, I would be so grateful if you would subscribe to our channel. We create content specifically for adults over 60 because you deserve health information that actually applies to your life. Hit that subscribe button right now and tap the bell icon so you never miss a new video. And here's what I'd love you to do next. Share this video with someone you care about: a spouse, a friend, an adult child who helps with your health decisions. This information could help them too. Finally, I'd love to hear from you in the comments below. What's been your experience with blood pressure? Have you ever felt over-medicated? Do you have questions I didn't answer? Let me know. I read every comment and often create videos based on what you share. Thank you so much for spending this time with me today. Take care of yourself, my friend. You matter, your health matters, and your best years are still ahead of you. Until next time, stay healthy and stay informed. End.